Hi, everyone. It's Melissa Secord from the Canadian Celiac Association, and I'm the National Executive Director. And this year, I am joined by Lizbeth Wall, who's our amazing chapter board liaison and national director out in Vancouver. Thanks for joining me today, Lizbeth.
Hi, nice to see you, Melissa.
It's always great to see you, Lizbeth, and I know you provide countless hours, on behalf of our community. And last year, I was joined by Janet Bolton to do a sort of a what's happening at CCA during our Celiac Awareness Month. And it's great to have someone on the board and a different perspective coming to the table this year. You have a great important role, working with the chapters. Do you want to talk to us a little bit about what you're doing with them?
Sure, I always love to talk about the chapters because we represent, as we have said many times, coast to coast to coast, and we're working on expanding that. We've got some really strong chapters and support groups, and they are able to take care of their community. They're able to reach out to the things that the national isn't necessarily able to do. The national, of course, takes care of the huge big picture of labeling and nutritional, but what we can do is go into someone's home and help them sort out their shelves. We can meet them at the grocery store. We can take that phone call. We can meet them for coffee. And with Zoom as well, too, that's also opened things up a lot for us. But the chapters have just exploded with their social media. The creativity is incredible. Their content is far-reaching. They've been able to do food drives during COVID, where they would have people that would be outside their doors and people driving by to picking up hundreds of pounds of food and lots of money as well too to bring towards our Save Me for Gluten. So what I'm loving about the chapters is the connection that have had with the national and how we've tried to sort out our roles as to what's the purpose of a chapter and what's the purpose of national. And I think at some time there was some overlap, and there is overlap, and that's
there'll always be overlap because I think there's an umbrella mission and cause, and the chapters are that local drive where it's the boots on the ground, it's that touch point. And what I love is because celiac disease is so regional because of food and restaurants, the chapters know like how to advocate locally and know the local bakeries, the local restaurants, the local grocery stores. Like for someone who's new, like they say, news is local, and it is. People need to know when they get diagnosed. We can give them the broad, as you said, the nutritional, the support, the resources that the Professional Advisory Council advises on. But locally, it's like, the doctors, the gastroenterologists, the local dietitians, they know the local day-to-day when you step out your door as a person with celiac disease. All those local resources is so key. And it's so great to have those wonderful chapter volunteers, there to support them.
A really good example of that is during May Celiac Awareness Month. We have a large South Asian community, as I believe Ontario does as well, or Toronto does as well. And so we just blindly reached out to the South Asian radio stations. They accepted our invitation. They invited us. We had one of our board members go on the radio station to speak. She made the mistake of handing out her telephone number. She ended up having over 30 telephone calls immediately after the program was over. So it's a really good example of what we're doing. But, Melissa, we're all volunteers. And as much as we try to find all the answers and do all the things that people are, it's so important for them to know, we don't always know the answers. So sometimes things are going to take a little bit longer. So sometimes at the chapter level, we're not able to answer the question. So then we go to our national, where we have an incredible expertise with nutrition, the labeling laws. We've got such a strong group in our national office, as well as our board members. And I think but we need donor support. We need people that understand the huge task that is expected of us And I often, I've said to you, I know, we act like a multi-million-dollar charity, and we're not there yet. We will be one day.
We're far from there, but we will be one day.
We will be one day, because it's going to be the people that are supporting us and have continued to support us, and I'm sure will be with us during this month and throughout the rest of the year, because they've seen the value of the Nicole Byrams and the Kayleys and you and the chapters and
the Professional Advisory Council. I mean, our greatest strength is our people. We have some wonderful dedicated volunteers, for example, on our Professional Advisory Council. And because we have so much work on nutrition and food and labeling and ingredients, we've actually formed a registered dietitian working group of volunteers with, the famous Shelley Case. We've got Ines Martinovic from Hospital for Sick Kids. We have dietitian Megan from Alberta Health Science. We've got Nicole Byram. So we've assembled, and Dana Wheaton from Manitoba. So we've got these amazing dietitians who are bringing their strengths and passion for celiac disease, all on a volunteer basis, creating these resources like the labeling guide. And they spent hundreds of hours of their own time, because they're just passionate to making sure that people can eat as safely as we can. And I know some people want black and white answers sometimes. And we can, as you say, we can't always give that. And it may take some more working with Health Canada. It may take more working with manufacturers for standards. It may take us doing some investments in research. But it does take time, and it does take energy and resources. And we're trying to do the work here that not just one person can do. Like one person, can't save, find out whether, corn flour is safe. That takes resources, time, energy, and money that National can do with support from the donors. So I do want to say, especially during Celiac Awareness Month, of the incredible support that we have received from the community in supporting the work of the CCA. If it wasn't for the donor support, we wouldn't be able to, work on things like our 4 key priority areas, and we can quickly go through there of some of the work we're doing. Yeah. So in terms of promoting evidence-based solutions, we've got our wonderful Professional Advisory Council that invests. We're doing more time and energy on research right now. Lizbeth, as you know, we've got a great State of Celiac Health survey that's going to be coming out soon, and it's coming out on the 20th anniversary of the original groundbreaking survey that was done in 2002. And I have to tell you, we had a meeting with our friends at McMaster Celiac Clinic the other day, and the famous Elena Verdu, who's internationally renowned gastroenterologist. She started her kind of celiac career or gastroenterology work out in Europe. And 20 years ago, just not long ago, they actually didn't think there was celiac disease in Canada. And I was flabbergasted. And
I've never heard that.
She came to Canada, and one of her very first research grants was the James A. Campbell Research Award from CCA that started her career on celiac disease. And since then, and she said that thanks to that original big study that was groundbreaking internationally, it exploded the work and the information, not just in Canada, but also in other countries, to learn more about celiac disease. So we're going to recreate that survey. It's going to come electronically this time, because we can do that now instead of the paper-based. But we're hoping for the community who's listening to this message to look out for that survey coming in the coming months and participate, because it's not a short survey. It's pretty in-depth, but it's going to really help us showcase to the research community, to stakeholders like at Health Canada, to help invest more dollars into celiac disease, because unlike a lot of diseases like diabetes, they've received millions and billions of dollars of investments in research, and we need our fair share, because celiac is a serious disease, and we want to put ourselves on the map. So thanks to the Professional Advisory Council and people like Kaylee, and teaming up with groups like McMaster, we'll be coming out with the State of Celiac survey to just learn more about how celiac disease impacts us today, and really define the key issues facing everyone, and then taking that and moving forward as we head into our 50th anniversary to really advance improvements in management of disease. So it's really, really exciting. And we're also doing a clinical practice guideline review, and they're looking through thousands of guidelines around the world, our Professional Advisory Council, and they're going to be bringing that forward to spur on Canadian-based clinical practice guidelines. So we're going to build the evidence to show that we need better clinical management of the disease, and ultimately that will get down to the family doctors, the nurse practitioners, the dietitians, to help improve the care that you receive, all thanks to the work of the volunteers and the staff and the resources at CCA. So really important stuff happening in Canada along the lines of research.
And we say volunteers, and that always makes people think, well, you don't need money when you have volunteers. But if we don't have the money, then we don't have the volunteers, and it becomes this catch-22. So it's so important.
Well, those surveys are expensive. Like it's, we'll actually have to hire a statistician to go through, like the last survey had 7,000 respondents, and a lot of that will take hours and hours, maybe, you know, a month or two of data collection. So we have to hire a statistician who can properly look at the information. We have to promote the survey. We have to be able to write reports on that. And that won't all be done by volunteers. That'll be done by, you know, staff and people that we'll have to bring on that are experts in that area. So
but that information is invaluable for us to move forward, so our community knows where their dollars are going. We get to hear where they want their dollars to be going, and we get to express what we think is really important and make sure that we're all aligned. So when our very, very generous donors give to us, they can give with confidence, knowing that the admin fees are very, very small, but used when absolutely necessary in order to move to the next level.
Yeah, and exactly. And as I said earlier, you know, we're doing the work that one person can't do. So collectively, you know, we bring forward this research, and then we can have these informed discussions with stakeholders, Health Canada, the ministers of health. It's pretty exciting. And some other work we're doing, and it's quietly working behind the scenes, but we've let people know about the Aboriginal Health Survey. You know, it's so important that we understand our Indigenous communities and their risk for celiac disease. And there's not a lot of work been done in that. And we really want to make sure that they too get the help and support they need, you know, for celiac disease. So we're quietly working away at getting that survey ready. It's just under ethics review. So we're doing some important stuff, and we're also surveying research. We've got, you know, Nicole and Kaylee participating in international research events. They actually, Nicole just participated in a big research event down in the US talking about oats and introduction of oats. And we know oats is such an important ingredient, you know, when they're gluten-free, of course, for the health of people. But there's a big CCA just in the last fall, and is going to be coming out with the kind of the results of that survey at the big international celiac conference. Is we're asking, you know, what are the international communities doing about the introduction of oats, and there's actually no standard. That's what we're finding out. So it's wow. It's through this kind of work that we're trying to learn best practices that will just either empower people and make them healthy. And ultimately, our vision is that every person with celiac disease is diagnosed and empowered. So all of this work kind of feeds into that to help, in the end, individuals live longer, healthier lives, you know, and if their families at risk for celiac disease, they get diagnosed sooner. You know, they don't have to beg their family doctor to test them for celiac disease. So that's sort of happening on the promotion of evidence-based standards. So a lot of important research work happening. And some of this work will culminate at the International Celiac Disease Conference that we want to go to in Italy this fall to present a lot of these findings. So we are asking for donations of Aeroplan points. I think we're halfway there. We need about 25,000 more points to help us use those Aeroplan points to help to send our representatives there. And in terms of strengthening standards, I know, Lizbeth, you mentioned a couple of times about the important work we're doing on labeling. We are frequently meeting with Health Canada, talking about products like natural health labeling to make it clear, better standards. As people will have seen maybe in our Facebook community, but other people may have heard that we've been pushing along with Food Allergy Canada issues around online ordering. When you, as an individual, I don't know if you do any online ordering, Lizbeth, you need to be able to know whether that product's safe. And sometimes what you see on a product, you know, in your hands, if I grab my bottle of water here, like I can see the label, but online, we're finding sometimes the information's missing and there's a gap in regulation. So during the COVID, where people were doing a bit more online shopping, you know, we were hearing those issues and we were bringing those forward at key stakeholder meetings. So now Health Canada is running a consultation process because of the noise that we've been creating as patient advocate groups. Now they're reviewing it to see if they can provide better guidelines for the industry. So we're the eyes and ears for the community. We hear things that come up and then we report them into Health Canada as the sort of the patient advocacy group. And you can see it actually makes a difference.
That's wonderful. I think for one of many of us that have suffered when we've picked up the wrong box, I mean, at the grocery store, nonetheless, picking up the wrong box online and then blindly eating it and then poisoning ourselves. This is incredible. And the labeling so far, even now, when you go to the grocery store and you're looking at something and I can see the wheat pop right out. And, you know, I don't have to have my little magnifying glass. And I always go, thank you, CCA. Were it not for you, I would be in this grocery store for another hour reading my labels. Yeah, it's very grateful.
And we're bringing issues forward like iron deficiency. And we know that we've been starting to have discussions around fortification because the regular bread needs to be enriched and fortified, but not necessarily the gluten-free. And so we know that 68% of people who are newly diagnosed are iron deficient or anemic, and that's considered by the World Health Organization as a major health issue. So we're bringing to light that issue and seeing whether or not we can encourage either more manufacturers to fortify, or do we need to, you know, encourage it through regulation from the government, because you know, people's nutrition, whether it's folate, you know, and iron is such an important function of people's overall wellness. So those are the issues that we bring forward. And the big win we've had recently, Lizbeth, as you know, from increasing standards and getting people to be diagnosed sooner and quicker, because we know there's been around a 10-year gap since that last big celiac survey we did, is the blood testing issue in Ontario.
Yes.
And we're really thrilled to that the government is finally, after many years of advocacy, and we sent about 1,000 letters to MPPs recently, that they've extended at least the pilot project for the blood testing for that diagnosis. But our work isn't done yet. We need to make it permanent under OHIP, which is the Ontario Health Insurance Plan. But we also need to get the next step is making it part of ongoing management. Because, you know, if you have diabetes type 1, you can have your blood sugars regularly checked at no charge. Why should celiac disease be any different? What are your thoughts on that?
I so agree. And one of the things that we think about is, say, for example, in British Columbia, our blood test is covered under our medical. And so I would encourage people, don't just think or sit on your laurels thinking that, oh, it's just Ontario's problem. Because if Ontario cannot sustain this blood testing, paid blood testing, could it not happen to British Columbia, Alberta, Saskatchewan, Manitoba? I mean, those, and across the country, because they're going to say, well, if Ontario doesn't have to do it, why does, and that's going to affect millions of people, hundreds of thousands of people. So yes, this is so incredibly important that we help advocate for the blood testing and help support Ontario. So it's you know, it's one of those things that there goes there, but by the grace of God go I, right?
You know, and that takes us in increasing awareness and education about that celiac disease is real. You know, and what our last pillar that we're going to kind of quickly talk about is increasing education and awareness. It's so incredible that celiac disease, you hear about it more and more, and it's thanks to that collective voice that we have that more people are hearing about celiac disease. But there's still work to be done. People still go, oh, what's a little bread? Oh, come on, it's not going to hurt you. And there's still struggles with people saying, you know, I want to be tested for celiac disease, you know, from their doctors, and they're like, no, you're fine, or just don't eat a bit of bread. So it's really important for us to keep pushing because we know right now that 85% of people are still yet to be diagnosed. And a lot of those people are family members. And so part of our awareness is just making sure that we help families or the individuals who have been diagnosed to try and share that information with their family members to understand why it's important to get that diagnosis.
Yeah, yeah, I absolutely agree. Absolutely agree.
And you see it in your own family.
Yeah, absolutely. I mean, you see, like in my own family is for example, and my brother and my nephew refuse to get tested. You know, they just don't get it. Where my daughter, who comes back with negative tests, or we think she is celiac. So that's a whole other story of she needs to do the further testing, and she needs her doctor to acknowledge that it is possible because she has a first degree relative. So yes, by educating the doctors and the medical community, it just don't go by just because you have an upset tummy and your blood work comes back negative doesn't mean you don't have celiac disease. Keep on diving.
And it's the ongoing awareness issue too, like just to keep doctors informed of the seriousness and the ongoing management that's needed. So once you're diagnosed and you've mastered the diet, you may think, oh, you know, I don't need CCA's help. Well, it's that ongoing management. You have a lifelong disease. There's constant research going into, you know, health issues. And like, for example, we're featuring Sonia from Vancouver with her incredible emotional story and journey with celiac disease with her neurological effects. You know, doctors thought she was having strokes. They didn't know what she had. She could barely walk. You know, she could even speak. And then at one point they actually said, maybe it's all in your head. Yeah. And which is phenomenal. And we know that, you know, Sonia's, you know, still going through her journey and it's not over, and she's needed the support of the CCA. She's has, you know, contacted Nicole and at our wonderful client support desk to offer that help. So, you know, it is a lifelong disease and we're learning so much about it. So it's important that you have a voice, but to inform those doctors, to inform the dietitians that will eventually help give you better care, it does take donations. It does take a lot of support and effort because there's thousands and thousands of doctors out there that need to care for thousands and thousands of people, and that does take some effort to. And thanks to the amazing donor support, we've been able to create a beautiful, you know, very stunning and touching public service announcement that's actually going to be on some CBC affiliates. You'll see it on YouTube, but we want people to do their part and share that with their friends and families to let people know this is a serious disease. So, you know, if you don't, maybe you can't donate, simply share and like and comment, share your stories. It's so important for us, for people with celiac disease, to share their journeys. You may think, oh, my journey's not that special, but you'd be surprised. You share that, you know, maybe on your Facebook page during, you know, Celiac Awareness Month, and your friends and family might go, wow, I had no idea what a serious autoimmune disease this is. So,
well, yeah, you're absolutely right. And I think it's just what you talk about complacency. So whether you were diagnosed 30 years ago or 3 days ago, we still need the CCA because things are ever changing, just like products are ever changing. Oats are ever changing. Rice is ever changing. Like there's always something that we need to be aware of.
Yeah.
Treatments. And treatments and solutions and cures that we hope to have. So were it not for the continued support of our, I mean, incredibly generous donors. And when we say generous, you know, it's whether you're giving thousands or whether you're my little next door neighbor who donated he's donating $27 because he had a gluten-free month in his family, and anytime anybody cheated, it was like a swear jar. They had to put money in. So this is 10 years old, donating $27. So that is so important.
It's all collective.
A little bit. It is.
You know, and we
no matter what you can give.
We used to have little Lucy in Toronto make gluten-free donuts and sell them at a local bakery. And, you know, that was her part. And we know we've got Amanda on Tiltify. She's a gamer and she's raising, you know, $500 for CCA because, you know, we were there to support her. You know, everybody sort of did the Davis Family Farm, you know, selling their amazing sunflower seeds.
Sprinkled across Vancouver.
Sean and Davis Weston, you know the impact that CCA has had on their lives, but they just want to give back as well. So every little bit counts, and we're selling sunflowers till the end.
I've got one. I just said I was sprinkling the little sunflower seeds across Vancouver. So if you're walking along the Lower Mainland, you see sunflowers spread out. That's me dropping a little seed here and there.
And it's like sowing the seeds of support and success. It's as you said, like $1 plants the seed for work to be done, and same with the sunflower seeds. So that support, you can see us grow, see the success. And I think, CCA, as we head into our 50th, I think celiac disease is starting to have a bit of a renaissance. We're getting noticed as a disease. There's a lot of great energy. The chapters are doing amazing things. We're getting amazing support. Our Facebook group is exploding. So we just want to keep this happening, because through that support, we can keep the momentum happening. We can be at the table with other diseases in front of Health Canada. We can get the research dollars coming to celiac disease. We can encourage researchers to take on celiac disease, because they do say that at a recent conference, celiac disease is an ideal autoimmune disease to start a lot of treatments and do the research, because they know the trigger, it's gluten. And for other diseases, autoimmune, they don't know what it is, but celiac disease can be the pathway to those other diseases. So there's some exciting things happening, and we just hope that everybody can continue to support our spring campaign, and hopefully everyone's enjoyed this quick update with you, Lizbeth. And again, thank you for your amazing work around the board table, your passion, your energy, and your many hours of support. We really appreciate it.
Well, Melissa, too, and you and your team, I mean, you've raised the bar so high that we're reaching for it, and we're all excited to follow your lead, and we're really, all of us are very, very proud to be a part of this organization. Thank you for having me here today, too.
Have a very successful and fun Celiac Awareness Month.